Well, I think that it's very interesting and very important to realize, for example, when you are prescribing nutrition in your clinical practice, and it can be enteral nutrition or parenteral nutrition, whatever, there are some things that you have to keep in mind. Nutrition is a drug. It's a therapy. So you have to go through all the questions that you do with other drugs. You would go like, do I have an indication for this drug? Which drug am I going to use? Is it going to be enteral, parenteral, or just feeding or oral supplements? What is the dosing that I'm going to achieve? And where is going to be the de-escalation? So this is the 4 Ds of the therapy. And I think these people are more and more aware of this fact, that it's a therapy, and that you have to approach it in this way. And my particular point of interest is the dosing. Because we know that when you measure energy expenditure, you see a large variation of results. And there's a big difference between the measurements or between the calculations that a lot of people make. So this is what I feel, that people come here and they think they know how to do it, but they can improve. We would always go for a measurement of metabolic rate. So we use the metabolic card in direct calorimetry to measure the energy expenditure of a patient. So this will give you a number. This will give you the energy expenditure of this patient in this time point. We use that number to make our prescription. And it used to be 100%, but now we have more and more evidence that probably you should be aiming at around 70 or 80% of this measured value. So this is very important. And of course you have to change it from day to day or from whenever the situation of the patient changes to adapt your therapy. So measurement is the best. If you want to monitor your nutritional intervention, you really need to know what you're doing. So what you need is a continuous or at least a 24-hour recap of how much calories and proteins and trace elements and vitamins have gone into the patient. So you need to keep track of it. You want to know how much enteral nutrition, parenteral nutrition, but also how much glucose, propofol, or other things that would supply proteins or calories to your patient. And then you want to compare this to the need of calories, the need of protein. So you have to make this balance every day. And then you can proceed with a prescription of the next 24 hours or the next time frame. When I look into the future, I see that metabolic therapy or nutritional therapy is going to catch up with the other domains of intensive care medicine, because we're a little bit behind because we were not asking ourselves the right questions. If we implement this dosing, indication, drug, and de-escalation, if we implement it in practice, we will advance very quickly. And personally, I see this metabolic monitoring growing, and it's going to be just another monitoring tool that you will use in your clinical practice. And I am hoping that we will go to even a continuous metabolic monitoring. So it's called COMO concept, that we have continuous metabolic monitoring as we have a blood pressure or a glucose. And then we will finally be at the same level.